Okay, so if you're studying for a big exam like the NCLEX, you know the feeling. It's just overwhelming trying to memorize all those drug facts. Well, today we're going to break down a really brilliant visual mnemonic for one of the trickiest ones out there, valproic acid. Seriously, this is a total game changer for locking in all the key details you absolutely have to know.
I mean, that's the real challenge, isn't it? It's one thing to know the information, but it's a whole other thing to be able to pull it out of your memory instantly when the clock is ticking. For nursing and medical students, forgetting one little detail can be the difference. So what you really need is a system, a mental hook that just works every single time.
And the answer this mnemonic gives us is, well, it's beautifully simple. You turn that boring list of facts into a story. And not just any story, but one that's set at this fancy masquerade party. What this does is it creates a kind of memory palace in your mind, where every single piece of information has its own visual spot. Now, every good story needs a starting point, right? A way in. For our mnemonic, the key that unlocks the whole thing is the very first person you meet when you arrive at this party, the valet. So here's the crucial link, and it's a simple sound association. The word valet is there to help you remember valproic acid, or its other name, Valproate. Now, you might hear the brand name Depakote out in the real world, but for exams like the NCLEX, they almost always use the generic name. So lock this in your head right now. Valet equals valproic acid. This is our front door. All right, so we're at the party. Now it's time to start looking around for our first clues. Remember, every little detail in this story is a key to figuring out what valproic acid actually does. Let's start with the first thing we see.
The first clue is this really nice car pulling up. And what's the first thing you notice? It's got these huge, oversized shocks. In this whole memory system, anti-shake shocks are the symbol for an anticonvulsant drug. It's just a perfect visual, right? The shocks stop the car from shaking, just like valproic acid stops the body from shaking during a seizure.
So how exactly does it stop the shaking? Well, think of it like this. The drug is doing two things at once. First, it's like it puts a speed limit on those hyperactive brain cells, slowing them down. And at the same time, it boosts the brain's own natural calm-down signal. It's this 1-2 punch that makes it so darn effective against a whole bunch of different seizure types. Okay, clue number 2 is right at the entrance to the party. You look at the decorations, and they're these masks that are half happy and half sad. The partygoers are all wearing them too, and this just brilliantly illustrates the drug's other major use. It's a mood stabilizer for bipolar disorder, which, as you know, is defined by those extreme shifts between mania, that elevated happiness, and depression. So, we know what the drug is for, but what about the risks? I mean, any mnemonic worth its salt has to cover the dangers, and this is where our story takes a really important turn. It embeds the most critical side effects right into the scene. And this right here is the pivot. Look, it's not enough to know what a drug treats. You absolutely 100% have to remember what it can harm. The next clues in our story are, without a doubt, the most serious ones. So, as the person in the story goes to drive their car, they notice the stick shift, but it's not a normal lever. It's shaped like a liver. This liver-shaped lever is the mnemonic's unforgettable symbol for hepatotoxicity. That's serious liver injury. For any nurse, this should immediately trigger a critical thought. I need to monitor this patient's liver enzymes, like their AST and ALT. Then, as they reach for that lever, something else happens. The story uses this exact quote to build up the suspense and introduce the next, and I'd argue, the most memorable warning of all. You can just feel that jolt of surprise and panic. And there it is, a tarantula. Now, why a tarantula? Because tarantula sounds a whole lot like teratogen. The teratogenic tarantula is this powerful, unforgettable warning that valproic acid can cause serious birth defects, things like neural tube defects. This is an extremely high-yield fact for your exams and, way more importantly, for a real-world practice. This is a drug that you have to avoid in pregnant women. Okay, let's just take a breath for a second. We've gathered all the clues, from the car all the way to that creepy crawly. Now it's time to step back and really see how this entire memory palace fits together as one single seamless story. Let's just walk through it one more time. First, you meet the valet for valproic acid. You see his car's anti-shake shocks, which tells you it's an anticonvulsant. You see the happy and sad masks at the party door. That's for bipolar disorder. Then come the warnings, the liver-shaped lever for hepatotoxicity, and that terrifying tarantula reminding you it's a teratogen. You see how it all just flows together? And that right there is the whole point. This isn't just about memorizing one medication. This is a masterclass in how to learn. By turning a boring, disconnected list of facts into a vivid, even kind of dramatic story, you anchor that information in your brain in a way that just memorizing flashcards never ever could.
So it really leaves us with one final thought. This technique is just so incredibly powerful, whether you're using it for medicine, history, or any other complex subject. It kind of makes you wonder, doesn't it? What's the most effective, most memorable mnemonic that's ever saved you on an exam or in a critical moment?